Hi, and welcome to How Humans Heal. I'm Dr. Donnie Wilson. In today's episode, I'm excited to introduce you to Debi Robinson. She's a functional bone health expert and a certified yoga therapist. And I'm very excited for her to be here to break some myths about osteoporosis and bone loss and help you to feel confident about what you can do to build your bone, including using yoga for that purpose, which is not something we often hear about, but Debi is an expert in yoga, and she's going to teach us about how we can use yoga to protect our bones and protect our health. Thank you so much, Debi, for being here with us today.
Thanks for having me.
Oh, of course. This is so awesome. And I really want everyone to understand your experience with yoga and how that brought you to this focus of helping women with their bone health.
Okay, so I came into this, I started practicing yoga in my 30s. And then in my 40s, something happened to my hip. And it was an injury, and I tore my labrum. And so all of a sudden, my mind is going to my hip. It changed the way that I practice yoga. It turns out I had a surgery. That surgery collapsed my hip joint, and then I had a total hip replacement when I was 51 years old. So that experience of having to have a hip replacement, having surgeries on my bones, raising awareness to bones, I started studying with a doctor with osteoporosis in an osteoporosis way because it was all bone related. Donnie, I don't even know if I had heard, I probably had heard of osteoporosis before, but I was in my 40s. So you don't really think about bone health really in your 40s. But yeah, my journey really began where my hip joint ended, where my collapsed hip joint ended. And I kind of went into the bone space with all that.
Amazing. Because I hear this story. Patients go through this in my experience as well, where, you're just like out of nowhere, you realize, oh my gosh, my bones need attention. And let's talk about, because the usual scenario is like with you, maybe you have a fracture or a surgery, and that's when you find out that your bones need attention. Or maybe it's postmenopausally and you have a DEXA scan and the doctor says, oh my gosh, you've got some bone loss happening. Let's talk through what is that experience for women when they get that initial eye-opening, scary information of, oh my gosh, your bones are in trouble.
Yeah, you're right. It used to be DEXA scan, which is typically recommended at age 65, which is ridiculous. Well, what I'm noticing now is women are going in, they're maybe falling or fracturing or having surgery without a fracture on a bone. And the orthopedic surgeons are noticing something in the texture of their bones, telling them to get DEXA scans. And women are finding out earlier and earlier. And that diagnosis, Donnie, that moment, something happens inside of you. You go from maybe not even thinking about your bones to a complete place of fear and fragility. And it's really undescribable. The way that I either say you get the rug pulled out from under you, or I say you walk into that office and for all you know, your bones are like the bricks of a castle. Like if you go to Scotland and you see these castles that have lived for centuries, right? Our bones are so strong, right? The strongest part of us. The minute you get a diagnosis of osteoporosis or osteopenia, you feel like your bones are made out of sand and your stone castle becomes a sand castle. It is a deep, deep fear and feeling of fragility.
Absolutely. Women explain this to me, and oftentimes in the doctor's office, they don't explain what the results mean or even what the options are beyond a medication. So let's talk about that. Like, what is your perspective on the standard treatment protocols for, let's say, osteopenia and osteoporosis or bone loss in general?
Well, we have a broken system, and we've been misguided and misinformed and misled since the 1990s. And it all happened because a company had a drug that got approved in 1995, Fosamax. A company had an X-ray machine to look at the bone density. And in 1997, Medicare approved that scan, and there was the pill. And so really, since the 1990s, we've been in this framework of scan, diagnose, and treat has to do with pills. Doctors are not educated on what it takes to build strong fracture-resistant bones. They know nothing other, very little training on diet, exercise, stress management, and all the lifestyle pieces. But the big thing, Donnie, is that we were thinking that osteoporosis is a progressive degenerative disease. And as you get older, your bones get weaker. That is not the truth. The truth is it's an inflammatory metabolic disease, which means lifestyle is going to be the drivers of the root causes of bone loss.
And that's just like mind blowing. And so I want to go have you say that again and even go into more detail. What does that mean and what the difference is? Because we think of osteoporosis is when, you see someone who's, let's say, maybe even over 80 years old, and they're now hunched over in their posture. And so I think that's what immediately comes to people's mind. And they're like, wait a minute, I'm only in my 50s or 60s. What the heck? How did this happen? And so to be able to, and to be told, oh, there's nothing you can do about this, or all you can do is take this medication, but the medication has a lot of side effects and it's not even that effective, and you can't take it forever, right? There's a lot of limitations to the other Fosamax and the other bisphosphonates or medications that are used for bone loss.
Yeah, and it is the only tool in the toolbox, and women don't want it. It's the number one decline medication are osteoporosis meds. And we are learning more about the negative side effects. You could get osteonecrosis of your jaw. Your jaw will break, just shatter, and the dentist won't even want to work on you if you've been on a bisphosphonate. You could get what are called atypical spontaneous femur fractures. And I asked an orthopedic surgeon once, like, how do you know that it was a medication? And he said, you could tell because it's an atypical fracture, the way that it breaks. And so the thing is what I would like people to understand is that our bones are our foundation. They're a reservoir of minerals. And throughout our lives, usually up until about our 30s, we are building. And after that point, there is a remodeling process of building and breaking down. It has to remodel. You have to get rid of old dead tissue so new tissue can lay down. About age 30, in the 30s is when that shifts. And now there's more breakdown than buildup. And then at menopause, when we lose hormones, it even accelerates more. The thing that we're understanding now, or that I'm going to definitely help us understand and bring more to the forefront, is that there are many contributing factors to bone loss. And it's not just as you age. You don't want to become the hunchback old lady at 80. So if you raise your awareness to what are the lifestyles, what are the factors that lead to bone loss, then you can actually stop those. And this is such new information because we could stop bone loss. We could reverse bone loss. We could reverse osteoporosis. And that is not something that was discussed. Let's say, well, I've been discussing it since 2022, but let's just say that people in this field really were not saying that, and you weren't getting doctors. Well, you were, a lot of them were just not wanting to say that.
Yeah, I agree. And I've been helping women with osteoporosis and bone loss since I've been in practice, since the year 2000. And so I completely agree with you. I've seen it before my eyes. I've seen patients who've been working with me for over 20 years, and we've been able to see their bone loss on their DEXA scan go from osteoporosis range to healthy range. So it just shows not only can we prevent bone loss, but we can reverse bone loss, like you're saying. So I just want everyone listening to know that that's actually possible, even if you're not hearing it from your doctor's office. Just like Debi's saying, your doctor's office is probably not going to say that to you because they're not educated in how to do it. It's going to involve not a medication, but some diet and lifestyle changes and some supplements. But it actually is possible. And I've seen it before my eyes in my patients, and it's really been so amazing and so cool. Before we go into more of that, in terms of understanding how gut health is related to the bones and so on, I just wanted to clarify for anyone maybe you haven't had a DEXA, or if you have had a DEXA, how to understand those results a little bit. And Debi, you mentioned that now Medicare will pay for a DEXA at 65. But when do you think really should women get a DEXA, and at what age would they optimally have a DEXA scan, if it is the way to do it? Mm-hmm.
I mean, so I think that there's more awareness now, Donnie, and you can potentially get one. My gynecologist ran one on me when I was 50. I'm so grateful she did that. That's what we call a baseline. So premenopausal, going into menopause, is when the greatest decrease of bone density usually occurs. And so if you could get one right around that time, it would be great. Or anyone who's going through any kind of cancer treatment and they're taking medications that could contribute to bone loss. The other thing is chronic gut issues. And if you're on a PPI, a protein pump inhibitor, that would also be something, or glucocorticoids. So certain medications can contribute to bone loss. So if somebody had a disease state that they were managing with medications that would lead to bone loss, or if you could get a baseline right when you're getting ready to go through menopause, so around that 50-year-old time frame. So that's when I would ask for one. And not to complicate things, Donnie, but there's actually a better technology in ultrasound, not as readily available, not covered by insurance, but it's called REMS, radio frequency echographic multi-spectrometry, and it's an ultrasound. But I would recommend that women either look for that, or they ask their doctor if they could get, their gynecologist, if they can get a DEXA. And I would try to do that around when you're going to menopause.
Thank you. And when you get asked for the report, right? So once you do it, ask the doctor to send you the report. And one of my quick ways to explain the breakdown of a DEXA scan is, basically healthy bones are at a 0 or plus, higher than 0. And when you start having bone loss, you're going into the negative. So you're going to see a negative. If you have bone loss, you're going to see a negative, like negative 0.5 or negative 1 or negative 2.5. And that's telling us, sort of the degree of bone loss is the deeper you go into the negative. And they're going to especially focus on the hip and the spine, because there's different bone types in the hip and the spine. So when you get your DEXA report, you're looking for, how's my hips, how's my spine, and how far in the negative am I? Maybe Debbie can fill us in even a little more how you explain that.
Yeah, part of it, they look at the spine because it's really all they can look at. So they look at lumbar 1 through 4. And actually most of the spinal fractures, which is where most of the fractures in osteoporosis occur, is in the spine, are up higher in the rib cage, like below the heart to right around the belly button, below the belly button. But we look at the 4 vertebra of the lumbar spine, and then we look at the hip joint. And the hip and pelvic fracture area is what we really want to avoid. I would say for listeners in the 50s, 60s, even 40s, and even younger, honestly, raising awareness to the fact that we can actually build strong fracture resistant bones, that we can stop bone loss. That is number 1 to focus on, thinking about your bones when you're taking care of yourself. But then getting a DEXA scan, not getting too scared about this crazy statistics of what can happen when you're 80, but getting a DEXA scan for a baseline. And in terms of those numbers, most people are going to be in the negatives, because the 0 line is you at age 30. And if you're not 30 anymore, you're probably not going to look like 30 inside. Donnie, as we age, we notice what happens to our body, right? We have wrinkles on the outside. Well, there are also wrinkles on the inside, and bone loss is some of that. So you're mostly going to be in the negatives. Once you get above what's called negative 2.5, that's when you go into this category of osteoporosis. And when you're below that 2.4 and below, you're going to be osteopenia. Just to know, though, I don't hang my hat on a DEXA scan. Just to know, though, that you have a control over all of it is what I think I really want the messaging to be, that you can control all of that.
Amazing. Absolutely. So then just know your number and then say, hey, that's my starting point. Now what am I going to do about it? And one of the things that you really focus on is this relationship between gut health and the bones. And I really want to dig into this because I think could be really surprising for people to realize, wait a minute, what does my gut have anything to do with my bones? So please help us understand why is it that you emphasize your digestion and your gut health when it comes to improving your bone health?
The thing that builds our bones are the foods that we eat. We need protein, vitamins, and minerals like that. Those are the building blocks of bone tissue. The bones store minerals. And so we need those things to come in our body, but we are not what we eat. We are what we absorb. So the food that comes in, it needs to get from mouth to bone. And that journey, you have to go from the mouth to the stomach, to the small intestines, into the body, goes through the liver, and then it gets delivered wherever it needs to go. And your body needs to manage any toxins that come in. It needs to manage waste products. And so this whole entire flowing system from mouth to anus matters because we bring in the nutrients. It comes into our body, it goes to where it needs to go, and then we need to eliminate what our body no longer needs, any waste products. We pee, poop, sweat, and breathe things out of our body. So the gut is where all that absorption takes place. Like right after the stomach, the small intestines is where 80 to 90% of absorption takes place. So we need to make sure we are digesting, we are absorbing, and then we need to make sure that that barrier, I call it our fortress. I refer to castle bones, right? Castle stone bones, sandcastle bones. We have a fortress. We have a barrier, just like a castle has a fort around it for protection. We have this lining, which is one cell and 2 layers of mucus. And that fortress has to be intact, because if it doesn't, we hear that 80% of our immune system is in our gut. Well, the reason why is because that's where your outside world can become your inside world. So you've got your soldiers, your immune system waiting to see what's coming in, what's coming in. If you don't have a really nice barrier, then you're going to let things come in. And osteoporosis is a disease of inflammation. And that's where most of those triggers of inflammation will occur, which is why we have to pay such critical attention to gut health for bone health.
And it sounds like you're referring to leaky gut, right? This leaky gut situation. And so if we can understand leaky gut, identify that, and I always say, it's not if we have leaky gut, it's a matter of how severe is the leaky gut. Is it mild, moderate, or severe? Because the more severe the leaky gut, the higher the inflammation is going to be. Is that what you also talk about in that area?
Yeah, and you just said it's not if, it's what, it's how severe. And it's true, because we've been bombarded by things that will affect that barrier. And until you understand what are all the things that affect the barrier, then you don't know that. And there's certain foods that can affect that barrier. There are the protection of that barrier is our microbiome, that the bacterial balance inside of our gut. Those bacteria, the bacteria are what actually creates that double mucus layer and supports that fortress. If you are not optimized in your microbiome, which is a big part of that is diet, we need to feed them. There's prebiotic fibers that they eat. And so we need to have the right food. We need to actually be digesting the food that comes out of our stomach and make sure nothing gets in that way, which aging can have a role there. We lose our digestive capacity. If you are not managing stress and you're eating in a stress state, your body won't fully or properly digest. And if you don't, and the food that comes out of the stomach into the small intestines, if it's not in the right format, it's not the right food to feed those protection bacteria. So it really is, as you said, not if I have leaky gut. Most of us do, because we've been exposed to toxins, to stress. Maybe we're not eating the right diet that's going to support that protection and that food base for those microbes. And we have to understand that there's this whole role of balance that needs to take place for health, and in my world, for bone health.
And a lot of times what I find that people feel surprised about is that sometimes you don't even have any gut symptoms. Like, definitely say someone's having GERD and maybe even been taking a PPI, or maybe they're having gas and bloating, or they know they have an inflammatory bowel disease. Then it's really obvious, okay, we got to go address the gut. But what I see is even 50% of people have no gut symptoms, and still we need to be paying attention to their gut. Do you find that as well?
Yeah. And what's really funny about that is we do questionnaires, right? Do you have gas, bloating? Do you have excessive food cravings? Do you have acid reflux after you eat? How's your energy? Do you have brain fog? Are you pooping every day? First thing in the morning, or do you have diarrhea? Or do you have weak nails? Is your hair falling out? You have skin conditions, like all of these things that we would ask somebody. And maybe somebody doesn't have that many of them. And I find that I work with a population that's very naturally minded. So they think they're doing all the right things. And that's the thing, right? Right things. So they think they're doing all the right things. And then you'll say, okay, we're going to start working on a gut healing protocol. And one of them, food, is one of the biggest contributors to disease. So we start with an anti-inflammatory diet, and then some supplementation and whatever else we're doing, some gut lining repair. And then they'll notice, wow, my sleep is better, or my poop is better, or wow, my hands don't hurt anymore. They didn't even know their hands hurt. They didn't even realize that they had the symptoms that they have. They were desensitized, or living with things that they didn't realize were things they didn't have to live with.
And so sometimes finding out that your bones need attention is like an opportunity to pivot your whole health and improve your whole health. Like it's amazing to me how like here you are, you might have the focus of I'm going to improve my bones, and you end up preventing heart disease, diabetes, dementia, cancer, right? You're preventing all these other things because you're helping your whole health.
Yeah, exactly. And that's the thing. You know, the bones are foundational. They're in the center of our body, and they are the reservoir of minerals. And those minerals at the bones are one of the first organ systems to respond to stress. So when we get in a stressed out state and all that biochemical reaction is taking place inside of us that we've got to get to safety, your bones are what helps you move. And inside of the bones are the minerals that are going to run the show. They contain some of the nutrients your body needs to do all of those physiological reactions to the stress response. And that doesn't just mean that you have crazy stress going on, Donnie. That means you just heard something someone said. You just smelled something that triggered something that happened when you were 5. You just listened to something or watched something that was stimulating. And it could even be the way that person just looked at you. You know, you walk into a room, maybe you have some insecurity or you know, you're a little bit cautious walking somewhere, and something happens and you're like, wait, what did I say? You know, that gut reaction, the bones are responding, and your bones are going to dissolve the minerals they store in order to do whatever it is your body needs to do. So yes, take care of your bones. You're going to be taking care of everything else in your life.
And the tricky thing is we are under stress all the time as humans, and we just kind of like dismiss it as like, well, there's nothing I can do about it. What am I going to do? And we're so overwhelmed by it, we don't even know where to begin. And we certainly aren't realizing, because we can't see our bones until we have something like a DEXA scan, so we don't realize that they're being affected. So I'm so glad you're opening our eyes and saying, wait a minute, if you're under constant stress, you better be starting to do something about that, because your bones are likely being impacted even though you can't see it or feel it yet. You don't even want to get to that point where you have a fracture. We want to prevent that. And if you do know that you have bone loss, then absolutely it's time to start looking at stress. And this, I would love to turn our conversation into talking more about yoga, because in my book, the Master of Stress Reset Your Health book, I talk about my stress recovery protocol, helping people to recover from stress, including optimizing cortisol and gut health and neurotransmitters. And I go through a whole plan how to do that. And part of that plan includes what I refer to as recovery activities, as well as exercise. And the cool thing about yoga is it fits both of those categories. It can help us with stress recovery and with in movement and exercise. And I know that you have been practicing yoga and specializing in yoga for all these years. So I want to have you explain to us, you know, because a lot of times when people hear about bone health, we hear about weight bearing exercise, and they might think about walking or running or, you know, these kind of, or lifting weights. But I want to hear your perspective on how is it that yoga can help with our bones that maybe we didn't realize?
You know, I think that it's misunderstood. I think when it came here as an exercise. It required tremendous flexibility. Whenever I tell someone I teach yoga, they should come take yoga, they say to me, I'm not flexible. And what I say to them is yoga doesn't require physical flexibility. It requires mental flexibility.
That's a good one.
Yoga is not actually a workout. Yoga is a work in. The word yoga means to yoke the body, the mind, and the soul. It's you, and you. It's all parts of you. And we live so disconnected. So when we hear about bone health and we hear about we got to do heavy weights, because we need to develop strength. We need stronger muscles, which leads to stronger bones. But I would suggest that there's actually 4 main areas we should focus on when it comes to bone health. We should focus on strength. Yes, bigger, stronger muscles are going to lead to bigger, stronger bones. We need posture, because half of all the fractures in osteoporosis are in the spine. We need to stand up straight, and we need the muscles in the back of our body to be strong to hold us upright. And we need to lengthen the front of the body muscles, because we sit all the time and they're contracted, pulling us forward. And raising our awareness to that. So we need strength, we need posture, we need flexibility, because we need to be bendable and not breakable. And so If you are going to misstep on something and your ankle joint is going to move or your foot's going to move, you need your ankle joint to be able to receive that. You need your ankles to be limber so that if they do bend a little bit, it's not going to pull in the bones and fracture them. If you are walking and your leg slips out from under you on a banana peel, you need your legs to be able to take that wide range of motion, and those muscles that attach your legs to your body, that precarious hip complex area, you need the dance in your hips. You need that play and that range of motion. So when you pull on it, you don't break it. And then we need balance for fall prevention, because bones don't break because they're fragile. They break because we fall. So balance, flexibility, posture, and strength. Yoga, from a physical perspective, works on all of that. And if you practice yoga the way yoga was intended, it's not a workout, it's a work in, then in that moment, you are matching breath with movement. You are staying right here, right now. There is no stimulation of cortisol, which is the biggest bone dissolving hormone in the body, the stress hormone. You are right here, right now, staying in the moment, working on strength, flexibility, posture, and balance. So to me, yoga is the best thing when it comes to bone health.
Having optimal cortisol and adrenaline levels is essential for health and longevity, and yet the stress in the present and in the past can affect our cortisol and adrenaline levels, causing them to be too high or too low. The thing is that we're not all affected by stress in the same way. So over the past 2 decades, I've been researching and discovering how to help my patients recover from stress. And I've identified the 5 stress types, which are the 5 common patterns of disruption in cortisol and adrenaline levels. The reason why this is so important is because the treatment is different. When cortisol is too high, we use different herbs, nutrients, and other modalities to bring levels back to optimal than if the levels are too low. So that's why I, through research, developed the stress type quiz, which allows you in under 2 minutes to discover what likely your cortisol and adrenaline levels are, so then you can make decisions about which herbs, nutrients, and other healing activities to choose to help optimize your cortisol and adrenaline again and improve your health now and into the future. Just go to stresstypequiz.com where you can take the quiz and take it from there. Oh, thank you so much for explaining that. It makes so much sense. It gives me goosebumps. I'm like, wow, like it's so perfect. And yet we don't hear about it enough when it comes to bone health. So I'm so glad that you're teaching and you're guiding. When someone's thinking, okay, I want to do some yoga, what do you suggest? How best to find a yoga teacher or class that's going to be best fit for them so they have a good experience with it?
So I do say this, and I probably should say it a lot more. I have a hip replacement because a yoga teacher tore my hip when I was 44 years old. He pushed my body and he tore my hip joint, and it has changed the course of my life. So for me, you don't want another person to be moving your body, to be adjusting your body. You want to develop that interoception, that inner body awareness, so you know how to move your body efficiently and effectively. If you're going to work with someone, it should be with someone that knows your body. If you're an aging female, if you're in menopause, then work with somebody that's also in that category and understands your body type. And especially if you have osteoporosis, make sure you work with somebody that is skilled in that. And if you don't have access to a class, I mean, I do a lot of stuff online, so there's no reason why somebody can't find somebody skilled that it works with yoga. And one other thing I want to say, Donnie, is I'm a yoga therapist, and so to become a yoga teacher, it's a 200-hour certification, and a lot of people are yoga teachers. To become a yoga therapist, it is a 1,000-hour clinical training after that. You are trained by chiropractic, physical therapists, MDs, NDs, nurses. We're trained in clinical conditions so that we can understand how to use the practice, or to not use, but to take the practice of yoga and specialize it for hypertension, for cancer, for fibromyalgia. And we learn about conditions and what would be the restrictions, limitations, or counterindications for somebody with that condition. And so a yoga therapist does 1,000 hours of training, and then they go through a clinical rotation at the end. So if you actually could find a yoga therapist, then you have an even higher level of skill set, and especially a lot of knowledge of anatomy. And you're going to need that if you have osteoporosis, for somebody who understands, especially the spine and what you should and shouldn't do when it comes to spinal movements.
Oh, thank you for explaining that. I didn't realize the difference. And it definitely sounds like if you're with dealing with osteoporosis, working with a yoga therapist is going to be someone who's much more educated and able to support you so that you can be more confident that you're not going to get injured in the process. Like with any type of exercise or any activity, you want to be working with someone who has that knowledge to guide you so that you get the benefit and not any risk. And so I love that you were mentioning that you do online support. And I know you have your Healthy Gut, Healthy Bones online program as well. So I want to make sure everyone knows, like, and I'll be sharing for sure in the podcast notes as well, that you have your podcast and you have your online programs. And tell us more, like, what is it that if people they're like, I want to learn more from Debi, how to save my bones and save my body at the same time. What are you offering through your services?
Yeah, so I have so many ways. I mean, my podcast, Stronger Bones Lifestyle, that you've been on, Donnie. Stronger Bones Lifestyle, because for years I ran functional labs on women with osteoporosis, helping them stop and reverse bone loss. And I really found that it's a multi-pronged approach. It is lifestyle. It's what we eat, how we think, and how we move every day that's either building or dissolving our bones. And that's the term I use, building or dissolving, building or dissolving. And you learn what are the bone building habits, what are the bone dissolving habits. So Stronger Bones Lifestyle is the name of my podcast. Lots of amazing speakers on there. And we always come back to the bones when I'm doing interviews. And I have a community, so that's free podcast. I have YouTube channel, Debi Robinson Wellness, free. I have over 700 videos on there. A lot of yoga therapy sessions that I taught during the time when I couldn't teach live. And then Stronger Bones Lifestyle Community is a really low ticket, $27 a month. That's my community. I do lives in there, Q&A in there. I'm also a chef. Donnie, I went to professional cooking school. So I do cooking classes for bone health and gut health and optimizing digestion. So Stronger Bones Lifestyle is a really low cost community because that's like a great entry level and you're going to learn a ton. I've got recordings in there. Some of my podcasts are in there. And then I have a program called Healthy Gut, Healthy Bones, which is my foundational program on learning how to change your lifestyle, focusing on optimizing gut health to optimize bone health.
I love it. It's so valuable and so helpful, and especially for people to know that they can access all of this online. You don't have, because it's really hard to find someone often in your local area who has this knowledge or has this information. And so to know, hey, you can come to Debi and start learning from her. And this is a process, right? It's not like this is not something we're looking for an overnight change. This is something where we're looking for change over time, over months, over years. How do you talk about that for people? How to get the right mindset about how to create change for your bone health?
Well, you need your bones, right? You need your bones. And if you raise awareness and learn, are you building or dissolving, building or dissolving? And that they're living tissue, constantly remodeling all day, every day. And that's beautiful because that means we can actually do something about it. You don't want to end up at age 80. I mean, the statistics, 1 out of 2 women will fracture a bone in her lifetime. Every 30 seconds, I believe worldwide, someone is falling and fracturing a bone. And if someone does fall and fracture a bone, actually closer to the 80-year-old time frame, there's a 50% chance that a year later you won't be here. I mean, it can be deadly. So it's a horrible quality of life if that happens to you. So I hate to do the scare statistics, but to be honest, Donnie, my body was broken at age 50. My hip joint was collapsed at age 50. So I was stopped in my tracks, which is why I'm so adamant to do what I do now and to share this information. But our bones are constantly remodeling. And so this isn't something, let me do a program for 1 week, let me do a program for 1 month. It's let me learn the lifestyle that's going to build bones and not dissolve them. And that's why everything I do is called lifestyle. And so it's the way you eat, how you think, and how you move. So you're going to learn what are the foods that contribute to bone dissolving, what are the foods that contribute to bone building. And from now on, for the rest of your life, You want your bones to be building, not dissolving. You want them to be strong. So you make the best food choices with that information. You have to move your body, move it, use it or lose it. You will want to become bendable and not breakable. So you do that, and you do whatever movement pieces. And it's not go to the gym for an hour every day. It's do push-ups, do a plank, go up against the wall and push away from the wall. Practice getting up and down from a seat or from the toilet every day, the most functional way in your joints. So I like to teach what can I do every day that's working on my bones, not just go to the gym, go to a yoga class. And then what you do, your work, master stress. Stress is the biggest bone dissolver of all. Cortisol is a catabolic hormone that when it's secreted in your body is going to break down everything. And your bones are one of the first things that get broken down when you're under stress. So you've got to manage stress because you can't eat your way or move your way out of bone loss if you are not managing your stress.
So important and so good. And I'm curious if you could share with us, like, what are maybe one or two of the most shocking bone dissolving foods out there? Like, what do you see that people are eating that they had no idea was working against their bones?
Gluten is probably the number one because gluten negatively affects thyroid, which is a master metabolizing hormone, and you need the metabolism. Osteoporosis is an inflammatory metabolic disease. It also affects your one of the secretions of the bile, which breaks down fat-soluble vitamins. You need vitamin D and vitamin K. And it contributes to leaky gut in almost all of us. It's hybridized. It's sprayed with glyphosate. There's just a lot of reasons that gluten is like off the table. And okay, 80-20 or 90-10, right? You don't have to be 100%. Dairy, because dairy is inflammatory. There's two proteins that are inflammatory. There's a growth factor in dairy that's not healthy for us. We're not really sure. It's pretty inflammatory. And women are eating their dairy for their protein and calcium. And we don't need as much calcium as we've been misled to believe we do. We don't need 1,200 milligrams. We probably need around 700 or 800, and you can get it in your food. It's in everything. It's a structural mineral. Sugar is inflammatory, so we don't want that. And then there's some other things. There's limit coffee or limit caffeine and alcohol. And there's some other things, corn, non-organic, soy, but really truly the big ones are sugar, dairy, and sugar, dairy, and gluten. Gluten is
I think people will be surprised about dairy because we were taught, I remember from a young age, all these advertisements, oh, you've got to drink your milk for your bones. So what happened there? Why the disconnect? And I think that's going to take a little bit for people to go, because people think automatically, my bones need help. I better go get some milk, or I better go get some cottage cheese, right? That's the way we've been taught to think.
Yeah. And yeah, that's the thing. I mean, on my podcast, I interview so many functional MDs that they, discuss that as well. And I think the more information we hear, the better. So I used to run functional labs, food sensitivity. They were blood labs, and it looked at immunoglobulins. It looked at IgG, IgA, IgM, and IgE markers. And I would run what's called a dairy zoomer. So it was specifically looking at all the proteins and all the peptides of dairy. And I run them on women 60 plus with osteoporosis or osteopenia. 85% of the time, high reactivity. So this is not does it, it's doing it. So that's like, the proof right there. But so there's two milk proteins that we are inflammatory to humans. Cow milk is for calves. We are the only mammals that drink milk after we're weaned. Cow milk is got calcium molecules to build calf bones. It's got an accelerated growth factor in there that is inflammatory to our immune system. So we're actually bringing in something that, and I know it's a really hard one to break apart from, Donnie. It really is, because
it's addictive too, milk products.
Yeah, well, they're addictive. Yes. I mean, I gave them up so long ago. They also contribute to mucus. So they're not great for mucus if you have any kind of issues with mucus. The biggest point, though, is we don't need them. And I think I believe it was the Dairy Association that had a very big role in establishing the RDA for calcium and the marketing. And so there's a doctor, a functional medicine doctor, Dr. Mark Hyman, that went against the Dairy Association, or whoever put out, it was the milk board or something that put out Got Milk, and they had the milk mustaches, right? So he did something, and he said, got proof. And he actually made them take down their campaigns because he showed that it wasn't true. And the countries with the highest dairy consumption have the highest fractures. If you look at Asia doesn't really consume a lot of cow milk dairy. They don't eat a lot of dairy, and a lot of those cultures are lactose intolerant, so they don't really have a lot of dairy. And there's plenty of people that have strong bones. We have some of the highest fracture risks here in this country. So you have to kind of look at all of this. I know it's hard for people to break apart. And if it is about the yummy factor, there's plenty of yogurts and ice creams, if that's your thing, that are there's alternatives. And I mean, I'll eat cheese. I eat cheese every now and then. It's not like I'm not 100%. You just have to, it's going to be contributing to inflammation, and inflammation leads to bone loss and many other diseases.
So thank you for breaking that down. I think it's so important. I also have been gluten-free, dairy-free for decades. And again, like you're saying, it's not, sometimes now I'm able to have, because I've done the leaky gut healing and my body's less reactive. At the same time, when we come back to these numbers and this research and we go, wait a minute, certainly if someone's facing bone loss and they're wanting to recover their bones and reverse osteoporosis, then definitely don't fall for the myth that you need more milk. That's not a lack of milk that's causing that. And it's not even necessarily a lack of calcium. This was the other thing, is a lot of times, we heard, like, say it was maybe a decade or so ago, there was a lot of fear around calcium. People were worried, calcium's going to go straight to my blood vessels. And so what I'm seeing is a lot of people end up avoiding calcium altogether. Because, and actually in some ways I agree, because for a long time, practitioners were recommending just the over-the-counter, really low quality calcium that wasn't even being absorbed very well, let alone getting to your blood vessels. And so I love that you're saying, hey, yes, we need calcium, but we can get it from our food. We don't need anywhere near as much as they're saying in the RDA. And my point is always, it's not just about calcium. We need the calcium with the vitamin D, the vitamin K, magnesium, and other nutrients. So it's not just calcium by itself.
Exactly. And they all play a role. They're synergistic. It's like an orchestra. You can't just have the violin. It doesn't sound so beautiful without everything else. And yes, calcium, 99% is stored in your bones. We need the vitamin D to get it absorbed. We need the magnesium to put the calcium into solution, and we need the vitamin K to bring it into the bones. And then there's cofactors, and we need amino acids, and we need silica, and we need manganese and boron and B6, and we need a healthy gut to make sure that the food and or supplements, if you're taking supplements, are being absorbed and utilized into your body, digested and absorbed and assimilated. So it's this whole entire process. It's this lifestyle. And the more you learn, the more you know. And, it's just education. And we're so wrong with bone health. We've been so misguided, so misled, so misinformed. It's been the whole entire machine, the patriarchal, money-driven machine since the 1990s that's controlled the narrative on this. And you don't need to spend a whole heck of a lot of money to do all these crazy things. You need to eat the right foods, manage your stress, and move your body appropriately, focusing on strength, flexibility, posture, and balance. And you don't have to spend crazy amounts of money on crazy things to have that happen.
What did you notice with your bones, Deb? Because you shared with us that you found out that you had bone loss in your early 50s. How are your bones looking now that you've been implementing all this?
Well, it was really interesting. So when I had a surgery that collapsed my hip joint 4 months later, they took part of my femur bone, the top of it off, and part of my pelvic bone, and my hip joint collapsed 4 months later. So for 17 months, I thought I could repair myself, but because I was surgically altered in my hip joint, I couldn't. And so I was teaching 8 yoga classes at the time. And when I came out of that surgery, for the next 2 years, from one DEXA scan to the next, I demonstrated everything in my classes on my new hip replacement side because it had become so weak with 17 months of all of that pain, and I was avoiding it, and my right side did everything and my left side didn't. So I did everything on my left side in my classes, all my demonstrations. And then after 2 years, I had another DEXA scan, and my bone density was negative 2.4 in my hip, in my right hip, my natural hip, which is 1 point away from osteoporosis, and I was only 23. And so I realized, what am I doing? This is like my real hip. Why am I focusing on that fake hip? It doesn't need to be strong. It's not going to break. And if it does, I'll get a new one. So I started then for the next 2 years for 8 classes a week, doing everything on my right side, focusing on developing strength in that with my yoga, with all my different postures, loading down, bending, and doing all the things I was doing. And my DEXA scan changed from a negative 2.4 to a negative 1.9, which is a very significant shift. Of course, I was also running functional labs. I was eating the right things and supplementing correctly and not eating dairy, sugar, and gluten, minimizing my alcohol consumption. So, I was doing the lifestyle pieces too. And so, yeah, I hover now around that place. And, I've learned so much since then. I mean, that was, I get so much deeper into my career and my mission. And then I interview so many amazing people that just educate me even deeper. And then all the women I work with, and I've taught thousands of people yoga since 2010. So I have experience every week with live people and their stories. And so I know what's possible in my own body and in others.
I'm so happy for you, and I'm so grateful for you for what you do and for coming to share that with us here today. Is there anything else you'd like to share with us at How Humans Heal before we wrap up?
Just know that you can heal. How humans heal. Humans heal when they decide to heal, when they do the things, learn the things that are healing. And there are so many things that can heal. And we have such a tremendous inner healer inside of all of us. And when we learn how to support that healer with food, mindset, movement, all of the things we need to do, then our body heals itself.
And that's so beautiful to know that the bones can heal. I think that brings so much hope. So any of you who've just recently gotten the news, or maybe you've been sitting with this and stressing, because then you're stressing about your bones and it only makes it harder for your bones. So now I'm hoping your stress about your bone results has gone down and you've built up your hope and your plan for how you can start to take even more action to actually recover your bones. And while you do that, improve your whole health. Thank you so much for joining us today, Debi.
Yeah, thank you. Thanks, Donnie. Nice to be here.
Absolutely. And so glad that all of you have been listening in. If you don't already, please subscribe to How Humans Heal so you don't miss the next episode. I'll see you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdonnie.com.